So tooth grinding, basically, the dental term for it is bruxism. It occurs from young to elderly as well, but normally what causes it is stress factors are the ones that cause it. Depression, stress, mental instabilities, and people who worry a lot. Or to others, when you interact with them, they'll actually tell you, I'm not stressed, I'm normal. So to some, it's a sleep disorder also in some people. Some people sleep talk in the night. So a person who sleep talks, chances are high that they'll end up grinding their teeth. So in such a case, if it's noticed earlier, to avoid affecting the structures, especially the enamel, wearing off, which is also one of the causes of sensitivity, because once the enamel wears off, it exposes the dentine. So you need to go to a dentist to get you what we call a night guard. Night guards protect the teeth from wearing off during that grinding in the night. And also talk to the patient, counsel them, advise them on stress relieving management.